stand here and welcome everyone this morning. This meeting is one of those meetings that really is so good for the heart. After these meetings, we go home and we feel like I can work hard again. You know, this is why we work hard. So, good morning, everyone. I'm Bonga Chiliza. I'm a psychiatrist, and we are. Dave and I are the founders of AGMHI, and this is my job today, just to welcome everyone. So what we've done in the past is asked everyone to stand up and introduce themselves and say a few words, and that takes about half a day, and then we have very little time left to do that. So what I thought we will do today is just to acknowledge people, perhaps, and just share a little bit about the depth and breadth of the people that are here in this room today. So we have fantastic young people from East Africa. The East Africans, as you know, are always want to be first in everything. So we invited them to our home in Cape Town, and they decided to come earlier than the meeting, and decided to go and watch rugby in the Cape Town Stadium. And they are men embarrassed. Many countries around the world, and the Ugandans have done exceptionally well in sevens rugby. There's some very powerful, tall black men that push people aside on the rugby field, which was fantastic. So we've got some wonderful young men as well, and young women from West Africa. I'm particularly excited about the two registrars from Nigeria. Where are they? Yes. So I think as you'll get to hear, if you haven't been here before, in the next couple of days, our mission is really about how to reverse the brain drain and train people where they are, and not have them fly over to the UK or to the United States and never come back, which we know is the story of our talent on this continent. We have people from North America that have joined us. We have psychiatrists from Boston. We have psychiatrists from New York. We've got some students from, is it North Carolina? North Carolina. So we are really excited that we have these people. We also, at home, for the first time, I think, we have people from Durham, a number of, are there any Durbanites in the house? Any Durbanites? Neuropsychiatrists, we've got nurses, public health specialists, psychologists, and we've got a young man from Durham who is called Bonga, Dr. Mafuze, who's, that is my name. So I've been told by his mentor, which is the great Slim Abdul Karim, that I must take good care of this young man because he's going places. So we're really glad to have you here, Dr. Mafuze, and we're excited that you can say that you touched your tailcoat as you went up into doing some great things. My chief registrar from Durban is also here. Dr. Cizi Neni has done fantastically well this year to get all the registrars together. We also have people that are extremely super specialized on this continent, and as you'll get to see, we have very few of them. So we have someone who whispers to infants and looks at the infant mental health specialist. Misha Lachman has done fantastically well. We started a program, an MPhil program at Stellenbosch University for infant mental health. We have neuropsychiatrists who have done exceptionally well with HIV and are looking at CSF of people with first psychosis. Lindor Taylor, Dr. Taylor is also here. These are people that are exceptionally highly skilled, and very few of them in the house. We have someone who swears that they still speak like a West African, but have spent many, many years in Australia, so maybe they're going to tell us a little bit about kangaroo meat. And Gordon, very good to see you. I'm glad you're back on the continent, and hopefully you'll stay with us. So the story of the AGMHI really is probably, I think, one a timely one, a story that has been birthed in a timely way. It came at the back of other organizations. So when we met with Dave many moons ago now, he was here in Cape Town for an organization called Harambe. Those in Swahili know that means pulling together. So Black medical specialists in Cape Town at UCT and Stellenbosch University decided to form this organization to help each other as they were busy with their PhDs. And as you know, if you're doing a PhD, it's quite a lonely time. So we formed an organization to help each other, pull us together. And I'm glad to say that that organization has birthed other societies, like the Clinician Research Society that's led by Professor Salomi Masfime from UCT. It's birthed the Africa Global Mental Health Institute. And that organization has also produced the Head of Department of Obstetrics and Gynecology at UCT, the Head of Department of Pediatrics at UCT, the Head of Department of Dermatology at UCT, the Head of Department of Psychiatry at UKZN, the Head of Department of Cardiology at UCT, etc., etc., etc. So that time for Harambe was a very important time for people to get together and to help put each other to become academics. And that birthed the Africa Global Mental Health Institute. We are very clear that on this continent there are so many young, amazingly talented people that would just need a little bit of a head up, a little bit of a leg up, a bit of guidance, a little bit of support, a little bit of mentorship to do amazing things. So our mission is really about how do we come together as Africans and those in the diaspora to raise the level of research, the level of academia that comes out of African mental health specialists on this continent, how to look at research and make sure that we create our own solutions that are for our own people. And I think those that have been reading the global health literature over the last few years will really see that it is timely. There's a lot of people that are in the globe that are saying that global health cannot be about people from the global north coming to Africa to tell us what to do. We cannot come here and say, well, this worked in Massachusetts, so I'm going to come and plant this in Liberia. I think that a lot of editors of journal magazines, a lot of the big ones have written statements to say that it cannot be that you have research that is amazing, that is cutting edge, that is done in Zimbabwe, and yet you have only 2 Zimbabweans in a paper of 13 or 14 or 15 people. We cannot continue with that. So I think the time has come for us to raise our voices and to say as Africans that it is our time to lead on all these amazing publications and lead the knowledge that we've created. The reason why I think I mentioned a little bit about Harambe is because as Africans, I think we are particularly clear that in order for you to go forward, you need to look back. In order for you to look at the future and prospect, you need to look back and say thank you to your ancestors. There's a friend of mine who's a historian who said to us that if you look at the story of King Shaka Zulu, the Great, he, obviously, anyone's legacy is always sort of tainted by blood and good things, etc. But he said that the one thing that was not being spoken enough about by historians is that during that time when he rose to power and decided to amalgamate the different tribes around the east coast of South Africa, there was actually, at that time, there was also the same time, there was when the slave trade was starting in what is now called Maputo, Mozambique, in that area. So his amalgamation of the different tribes was actually a response to what was happening, to a threat on the lives of people in Africa at that time. So he came to power to say, how do we come together as smaller tribes to form a large, proper army so that we can stop the abductions that are happening, that we hear about, that are happening a little further up north on the East Coast. So obviously people will talk about what happened and how he ruled and things like that, but I think his rise was a response to what was happening at that time. So I really think that the AGMHI is also responding to what is happening this time, and I think that this year's theme of emerging voices in mental health will showcase some amazing work that has been done by young people on this continent with very little resources. We had to get them a little bit out of their comfort zone a little bit and make them download an app called Picture Pucha, which they've never heard of before. And we had to force them to tell their stories in a different way. And we're going to be hopefully tomorrow hearing amazing stories from these young people of the kind of work that they're doing. I think the two things I also just want to mention is that we are excited that we're able to support local NGOs or local businesses in this conference. Welcome. So the first one is that these lanyards are handmade by Kids Positive Beaver Project, a job creation initiative for mothers and kids HIV families. And those beautiful bags that you have came from the Care Haven Psychiatric Center, which is the oldest psychiatric aftercare center in the Eastern Cape. Care Haven provides residential and therapeutic care for people with mental illnesses who've been discharged from the state or the private psychiatric hospitals. So I thought it was appropriate and to also mention that. So I'd like to now introduce you to my co-moderator, Dr. Michelle Durham, child psychiatrist, child and adult psychiatrist from Boston, and she will continue with the rest of the introductions. Thank you. Thank you very much.
Welcome everyone, it's great to be back in person. I'm glad to be here with Dr. Chiliza. It's always great to co-moderate this AGMHI conference with him. As we've stated before, this is really an opportunity too for us to come together and think about next steps, and we think a lot about the working groups and how are we going to move forward with a lot of what Bonga just spoke about. So I just want to give you a brief overview of kind of what we're doing today, and a lot of it is going to be very quick and time limited, and we're going to have some brief presentations. We'll have our keynote address in a few minutes. We had some invited presentations about people doing work globally in the diaspora and all the good work they're doing and how we can learn from them. But then we're going to have breakaway sessions, and this is really the core of what we've done for our past conferences, of really thinking about how all of us together, and people maybe not in the room, can move some of the work forward along the diaspora. And so I just want to give you an overview of how that's going to work, and I'll reiterate this a little bit later as well. But we're going to have breakaway sessions. This divider will come up at some point. We're going to have two groups on one side, which is room 8 to my right. And then this is room 9, and we're going to have research, training, and education. And these are the work groups that you'll hear a little bit more about and what their updates are. So you'll have a little bit of an understanding, if you haven't been involved in the work groups, of what's going on. But what we're going to do during that time is really think about, with some grant proposals, some funding initiatives that you already have in your handbook, so you can even read them now. But that's going to be the framework to start the conversation about how do we move forward. We're going to, people will lead that, and we'll reiterate some of the steps I'm saying now. But we'll need someone that will present tomorrow. You'll have slides that you'll need to form as a group as well. And those slides will need to be sent to the email that we'll talk about a little bit later. But that tomorrow that we can present on the work that you would have done the majority of today. And so I just wanted to get people thinking about that it's all in your handbook about what those activities will entail. You will have people though helping to facilitate and moderate those work groups. Last but not least, on your tables there's QR codes, there's the link to getting on the Wi-Fi here at the conference center, but there's also, for those who are very active on social media, ways to tweet about what we're doing today and to get it out there what the AGMHI is doing, all the hard work all of you are doing in your respective countries. But get the word out there. We want this to grow, we want membership to grow. We have more details about that tomorrow as well. And so I just wanted to kind of give you an overview of that. And last but not least, what's really important too is that outside of the room, if you go to the right and then to the left are the restrooms in case at any point you need to do that throughout the day. But we really hope you are interactive and enjoy and ask good questions and enjoy the time together. But really think about this as more than just a conference and hearing people speak at you, but really being an active participant in how we move this work forward along the diaspora and on the continent. With that, I'm going to ask Dr. Chiliza to come back up to